As stated by Biryakova, So, and Barker, gender-related issues that have been found to contribute to attrition of male occupational therapists from the profession include hesitancy to allow males to carry out certain treatment techniques with females like dressing, use of male practitioners to perform manual labor tasks, and lack of appropriate departmental facilities such as male changing rooms. Recommendations include improve male occupational therapy networking to allow male occupational therapists to discuss issues together, employ strategic education and recruitment geared towards attracting and retaining men to the profession, include more diversity training for both genders in the curriculum, with less gender bias in educational texts and material, and employ gender-diverse occupational therapy faculty.
Hello there.
Oh look, DT's here, Emily.
Actually, we're here for an occupational therapy evaluation.
Oh, I didn't know men could be OTs. That's kind of like being a male nurse, right?
The patient's family member is demonstrating an explicit gender bias in regards to health professions. An explicit bias refers to the attitudes and beliefs we have about a person or a profession on a conscious level. Based upon the patient and her family's previous experiences, she believes that certain healthcare fields such as occupational therapy or nursing are solely for women. Her conscious awareness of this bias was verbally expressed, therefore making it explicit.
Oh, that works great too. After my accident, I've been having a lot of trouble getting out of bed, and I could really use help taking a shower, and the nurse told me that the OT could help me with that.
Oh, Emily, I'm sorry. I'm actually your occupational therapist that's going to be helping you out today. John is just my student who's observing.
The patient is now demonstrating an implicit bias. An implicit bias refers to the attitudes or stereotypes that affect our understanding of actions and decisions in unconscious matters. When watching this interaction, it is clear that the patient was not aware of her bias and did not even realize that there was a reason to ask who the occupational therapist was, because it was unconsciously assumed that the male had the leading position.
Well, that was a little bit awkward.
Certainly uncomfortable. Do you think there's any steps we can maybe take to help prevent that from happening again?
Yeah, definitely. Why don't we just have a quick chat before we meet with our next client?
Excellent. Sounds good.
Perfect.
According to the Institute of Medicine, health literacy is the capacity of professionals and institutions to provide access to information and support the active engagement of people. There are several factors that influence low health literacy rates among different populations, such as the use of jargon, incomplete or too much information, imprecise instruction, and the complex healthcare system. To provide culturally effective care and enhance cultural humility, it is important to practice strong verbal and nonverbal health communication.
Good morning, Emily. I'm Kelsey. I'm your occupational therapist today. I actually have a student observing. His name is John. Is that okay?
Yeah, of course.
Perfect.
For future interactions, it is suggested that Kelsey and the occupational therapy practitioners incorporate clear communication when first interacting with a new patient by clearly stating her name and role as she enters the room, as well as asking if student observers are welcome decreases the chance of incomplete information, which leads to low health literacy. Additionally, nonverbal cues such as removal of the student's white coat and the practitioner walking in first clarifies the roles of the students and occupational therapists.